Okay.
We're back with Mu Guo.
Spleen and stomach.
I'm not really great with the computer.
Liver and spleen. Alright, this is Mu Guo.
We're entering liver and spleen. We are alleviating cramps.
Yeah.
We're transforming dampness, and we're harmonizing the stomach and the spleen.
Great. Relaxes the sinews and unblocks the channels.
Like number 2 and number 3.
That's why it's in the same category.
What was that? Number 2 was Wei Ling Xiang.
Wei Ling Xiang, that was number 2, right?
Yeah, number 3 was Hai Tong Pi.
Hai Tong Pi. And the first one?
Du Huo.
Du Huo, and this is Mu
Gua.
Guo.
Mu Gua. So we are relaxing the sinews and unblocking the channels.
For damp, painful obstruction in the extremities, especially with severe cramping pain, and weakness in the lower back and lower extremities. This is one of the more effective herbs for relaxing the sinews.
Let's highlight that.
Okay.
More effective herbs for relaxing the sinews. We also have a note about the lower body, just like number 1 and number 3. Du Huo. I gotta remember them. Du Huo.
Okay.
Hai Tong Pi.
Du Huo, Hai Tong Pi, Wei Ling Xiang, and Mu Guo. Harmonizes the stomach and transforms dampness for abdominal pain, spasms, and cramping of the calves, and edema due to leg qi. Especially useful for disharmony between liver and spleen, leading to leg problems. Reduces food stagnation for indigestion.
Okay, this is the first one that reduces food stagnation.
Mu Guo.
Mu Gua, food stagnation.
While this effect is similar to that obtained from Shanza, it is not commonly used.
So this one is not commonly used, or Shanza is not?
Yeah, I guess Shanza is
More commonly used. Yeah. So I guess the most important thing to remember, really, about Mu Gua is that it relaxes the sinews and unblocks the channels, and is really great for relaxing the sinews compared to other herbs in this category, and also harmonizing the stomach and transforming dampness.
Okay.
Remember that the spleen does not like dampness, and so in this case we're trying to transform the dampness to relieve the spleen.
Okay,
and this
good.
is part of the harmonizing.
Mu Guo. Aromatic, sour, and warm. Mu Guo relaxes the sinews, opens the collaterals, harmonizes the stomach, and transforms dampness. It is warm without being drying.
Oh, that's nice. Some of them are more drying than others.
And enters the spleen and liver channels. In the spleen channel, it alleviates nausea, halts diarrhea, and thus treats sudden turmoil disorder with cramping.
What is sudden turmoil?
I don't know, I've seen some people like, whoa! Suddenly. My stomach.
Mu Gua! I need some Mu Gua! Stat! Okay, we're entering the liver channel. It expels dampness from the sinews and vessels, because the liver controls the sinews and the tendons.
Yes, and controls the movement of the blood smoothly.
Yeah, smooth movement. So that's the vessels part. Relaxes the sinews and invigorates the collaterals, and thus treats damp, painful obstruction disorder and muscular cramps.
I think this cramp thing is really recurring with Mu Guo.
Yeah. Cramps.
Li Gao noted that Mu Guo enters the blood level of the arm and leg greater yin channels. In abandonment of qi, Mu Guo can restrain. In stagnation of qi, it can harmonize. It is specifically indicated for the abdominal cramps associated with sudden turmoil disorder or gastroenteritis, but is also very, very effective for muscular cramps of the leg, which can result from blood deficiency or cold invasion leading to contraction. Regardless of the causative factor, the pathological mechanism which brings about cramping always involves the deprivation of nourishment to the muscles and sinews. Mu Guo is sour and warm, regulates the spleen and stomach, alleviates vomiting and diarrhea, and therefore prevents further loss of qi and fluids.
Oh, good.
The sour flavor, consolidate deficient leakage, mobilizes the sinews and relaxes cramping spasms.
So we don't have any notes on toxicity on this one. Oh, yes, we do.
Oh,
we do. Allergic reactions have been observed following skin contact with this herb. With localized pruritus. What is that word?
Pruritus.
And edema. Okay, so I would highly suggest reading over your toxicity notes, maybe even using gloves. Test it on yourself first before you test it on a patient.
That's a good idea.
It's better for you to be sick than making your patient sick.
Be careful. Do some research first.
All right, we're going to move on to the 5th herb.